Hi, I am Dr. Kanchan Dua. Surgical interventions account for an estimated 13% of world's total disability adjusted life years. While surgical procedures are intended to save lives, unsafe surgical care can cause substantial harm. In 2008, the World Health Organization published guidelines identifying multiple recommended practices to ensure the safety of surgical patients worldwide. On the basis of these guidelines, a checklist intended to be globally applicable and to reduce the rate of major surgical complications was initiated. The implementation of this checklist and the associated culture changes it signified was intended to reduce the rate of death and major complications after surgery in diverse settings. The checklist consists of an oral confirmation by surgical team of the completion of the basic steps for ensuring safe delivery of anesthesia, prophylaxis against infection, effective teamwork, and other essential practices in surgery. It is used at three critical junctures in care: before anesthesia is administered, immediately before incision, and before the patient is taken out of the operating room. The three basic elements of surgical safety checklist include sign-in, time-out, and sign-out. Sign-in is done prior to the induction of anesthesia involving the patient in the process. Before induction of anesthesia, members of the surgical team orally confirm verification of the patient, informed consent, and surgical site marking. The time-out process is done just before incision. The entire team orally confirms that all the members of the team have been introduced by the name and role, confirms the patient identity, surgical site and procedure, and reviews the anticipated critical events including prophylactic use of antibiotics. All the essential imaging results for the correct patient are displayed in the operating room. The third step is sign out, as a part of which the nurse reviews items allowed with the team. The surgeon, the nurse, and the anesthesia professional review aloud the key concern for the recovery and care of the patient. Introduction of the WHO surgical safety checklist into operating room in various hospitals around the world has been associated with marked improvements in the surgical outcomes. The reduction in the rates of death and complications suggest that the checklist program can improve the safety of surgical patients in diverse clinical and economic environments. Thank you.